Are you on a GLP-1 and feel like it is not as effective for you as maybe it is for other people? It could be your genetics. It could be your obesity phenotype. And we're going to talk about the third obesity phenotype today. My name is Dr. Lindsay Ogle, and I'm a board-certified family medicine and obesity medicine physician. And I am passionate about identifying patients' underlying pathophysiology, the underlying reason why they are having any condition, but today we're talking about the disease of obesity and then addressing that specifically so that each patient can have the most optimal results. I see patients all throughout the state of Missouri via telehealth. My clinic is called Missouri Metabolic Health. So if you live in Missouri, I would be happy to see you there. If you don't, then I highly recommend finding an obesity trained physician in your state who can create a similarly tailored approach and can show you compassionate care that you deserve. I'll include a link below about where to search and find an obesity physician in your state. But today we're talking about the third obesity phenotype, which is emotional hunger. I talked about the first two obesity phenotypes a few weeks ago. This video is a little bit delayed due to an issue with the hard drive that I saved the previous video that I recorded on. So I'm recording it again today. I hope it'll be better than ever. So thank you for waiting for this release of the video. People who have emotional hunger, their brain is wired to have a heightened pleasurable response to foods, specifically foods that have a lot of sugar and salt and fat, and especially if they have all three of those, your brain is going to light up and say, this is a good thing, this is helping me, I need more of this, and you're going to feel that more intensely than somebody who does not have emotional hunger. This makes it very hard to avoid those foods. And it's very easy to get in the habit of self-soothing with foods. This can be soothing for both negative and positive feelings. So stress, anxiety, boredom, feeling like you have too much attention or not enough attention, lots and lots of triggers can occur for somebody who has emotional hunger to turn to food to help cope. Again, this is not something that you have conscious control of. This is something that is hardwired in your brain, and why medication can be so powerful to block that reward pathway that is ingrained. Out of all four obesity phenotypes, emotional hunger is probably the one that is most often internalized, and people who have emotional hunger often end up blaming themselves for struggling with their weight. But the truth is, it is not a personal flaw. It is not a lack of willpower. There is nothing wrong with who you are as a person. Emotional hunger can actually be picked up with genetic testing. This is not something that I have done in my clinical practice, but there are tests available that can help determine what somebody's obesity phenotype is, and I'll include a link below if you want to learn more about that. But it is a part of your DNA. It is not something that you can control. Same way that I can't control the fact that I have curly hair, you can't control the fact that you have the emotional hunger phenotype. But what you can control is your treatment. And there is specific treatment that is optimal for somebody who has emotional hunger. There are two mainstays of treatment. The first is medication, and the second is a non-medication option. So the medication that is best tailored or best suited for emotional hunger, the brand name is called Contrave. Now, this is a medication that was FDA approved for overweight and obesity in September of 2014. So it's been almost 11 years since it's been on the market. This is a oral medication option that you take twice a day. It's a combination of two active ingredients, and these medications are used fairly often for other reasons. And so this medication may have dual benefit for you. The first part of the medication is bupropion, or the brand name Wellbutrin. And this medication is used for many reasons. It is a medication that we use for the treatment of depression, but it's not one of our typical depressive medications. So if you've tried medications before and you didn't tolerate them, but you have not tried the bupropion or Wellbutrin, then don't be alarmed by that. This medication is in a class of itself. The typical antidepressants are SSRIs, and the bupropion, it increases norepinephrine and dopamine in our bodies and in our brain. So it is a completely different medication than the typical antidepressants, the SSRIs. It is also used to help people decrease their cravings for cigarettes. So it can help people cut back or stop smoking, which is great. And it also is a non-stimulant option for ADHD. If you have any ADHD tendencies, if you may struggle with your mood or how you're feeling, then this medication may be something to consider. And especially if you have emotional hunger. The main reason you should not take bupropion, which is one of the active ingredients in Contrave, is if you have a history of a seizure. This medication may increase your risk for a subsequent seizure, so if you've ever had a seizure, you should avoid this medication. The second active ingredient in Contrave is naltrexone. Naltrexone is an anti-opioid, and so it blocks the opioid receptors. Even though it affects the opioid receptors, I do not want you to be worried about becoming addicted to it. This is the opposite of that. It is turning off, or like I said, completely blocking the opioid receptors. That is the main reason why you cannot take this medication. If you are taking an opioid, whether that is a prescription or not a prescription, if you are taking that medication and then you take naltrexone, you are going to be very sick. It's going to cause severe withdrawals, very, very bad flu-like symptoms. So if you are taking any opioids, you should not take naltrexone, and you actually need to wait about 2 weeks since the last time you used your opioid before you can take naltrexone. Naltrexone is most often used to decrease alcohol cravings. And so if you are trying to cut back on the amount of alcohol that you're drinking, then this is a great option because it'll help lower those cravings and help curb the cravings for alcohol. But you still can drink alcohol in this medicine. It's not one of those that will make you feel sick if you end up drinking on the naltrexone. It just will make you not want it as much. The most common side effects for naltrexone are an upset stomach. And so as with most medications, we want to start at a lower dose and then slowly work our way up. But upset stomach is by far the most common side effect of naltrexone. For bupropion, the other active ingredient of Contrave, most common side effects can be difficulty with sleep, headache, maybe anxiety or restless feeling. If those are happening, they may be temporary, so I would take it maybe a couple of days up to a week, but if it's not going away after a week, then it's probably not the best medication for you. Contrave is affordable, so if you are getting the brand name at the pharmacy, if your insurance does not cover it, it may be a couple $100s, but there's a program where you can get it for $99 delivered to your home. And so you can get this medication for $100 a month or less, which is significantly less expensive than the GLP-1 medications as of this recording. The second thing that is very helpful for somebody who has emotional hunger, and I will say outcomes are best when we combine both medication and this lifestyle option, and that's therapy. And therapy can be so powerful for many things. I think honestly we all should go through therapy at some point in our lives. Most of us don't get taught the power of emotions, how to identify what we're feeling, how to acknowledge it and process it in our body, how to communicate it to other people. These are skills that we can learn in therapy. I have many patients who maybe tried therapy in the past and they felt like it wasn't a good fit for them. I always say finding a therapist is like dating. It may take a few tries and a few relationships with therapists until you find the one that fits for you. So don't let a bad experience in the past keep you from the treatment that you would so benefit from. I think it's always a great idea to ask family or friends or coworkers, or go online and look for reviews and referrals for therapists. Because if you know that this is somebody who is compassionate and caring and effective, then you are more likely going to have a positive experience with that therapist. I'll include links below for psychologytoday.com, which is a great resource to search for a therapist in your area. You can even filter through what you're looking for help and your insurance. And so that is super helpful tool. There also is coaching, and this is something that is becoming more and more popular and more acknowledged. I recently had Lisa Salisbury on, and she is a life coach and wonderful. And so that would be somebody that I would recommend to work with, especially when it comes to body image and healthy lifestyles and just to augment your treatment. And there are many other coaches. I will include a link to a group of coaches that I highly recommend. Remember, you could have multiple obesity phenotypes. So you could have both hungry brain and emotional hunger, or hungry gut and emotional hunger. Or you could also have our fourth obesity phenotype, which we're going to talk about next week. This is why working with an obesity trained physician is so important, because tailoring your treatment to you and what will work for you is so important. This is way more than a prescription for Zepbound or Wegovy. We are focusing on your long-term health. We want to get to the bottom of what's going on. We want to treat the underlying reason, and doing so, you're going to have better results with less side effects, and it's going to be more sustainable long-term. I hope you found this helpful. If you have any questions, comment below. Please remember to like and subscribe and share with anybody who you think would benefit from this information. And I can't wait to see you next week to talk about phenotype number 4.